someone who only treats anxiety and anxiety related disorders. Hey, it's Dr. Shawn Nabors, West Michigan anxiety specialist and practice owner of the Anxiety Treatment Center of West Michigan. Today, I'd like to talk to you about the profession of anxiety specialist. It's very important to shed light on this profession because it is relatively unknown within the general public, because it is still relatively new. The 1990s is really when mental health therapists started specializing in anxiety and forming organizations and really focusing on narrowing in on that niche of practicing as anxiety specialists. What specifically defines someone as an anxiety specialist? Well, it is someone who holds a mental health license, meaning that they are able to treat and diagnose mental health disorders and also do either a lot of psychological testing or some very limited psychological testing. These licenses are typically your licensed psychologists, licensed professional counselors, licensed master social workers, and so forth. Also, what defines an anxiety specialist is someone who only treats anxiety and anxiety related disorders. So for years upon years, all these therapists do are see people and treat people who have anxiety disorders or issues or disorders that we would call anxiety related disorders. For example, OCD would be an anxiety related disorder because it's not technically under the anxiety disorder umbrella, but it shares a lot of features with anxiety disorders, which is why it's an anxiety related disorder. Also, anxiety specialists typically, almost all of them, use some form of evidence-based therapy to tackle anxiety. Anxiety has core features within it that are important to tackle in therapy, and a lot of evidence-based therapies are effective at tackling those core features of anxiety issues. These are therapies such as cognitive behavioral therapy, dialectical behavioral therapy, acceptance and commitment therapy, and so forth. So an anxiety specialist is someone who is a licensed mental health professional. They only see people with anxiety issues or anxiety disorders or related disorders, and they typically use evidence-based therapies to treat those. So if you are struggling with anxiety or you know someone who's struggling with anxiety, it probably would benefit you to do a Google search for anxiety specialists near you. If the people who come back in your search are people who specialize in anxiety and a bunch of other different issues, then you're probably not really working with an anxiety specialist. So you'll want to interview them and ask them specifically, are you an anxiety specialist? Now, anxiety specialists are excellent at treating anxiety disorders, but might not be so great at treating other things outside of anxiety due to our specialty. As competent as I am at treating anxiety, I really shy away from treating other mental health issues just because that's not my niche. Great wealth of knowledge when working with anxiety specialists for anxiety issues. But outside of that, some people or clients might also like to have a second therapist just to talk about life issues as they're specifically working on that anxiety issue with their anxiety specialist. So in short, that's what an anxiety specialist is. I thank you for stopping by as always, and take care.